Efficient.
Or if you want to go specifically what your positions are.
That's
Okay.
good.
And I don't know that the parents really makes a difference. Parents,
Nope,
honestly,
probably not.
Professionals, it's more interesting, but parents are just like, okay, educators developmental disabilities.
Right. Yeah, they're not. If they're like me, they're not going to remember anyway. They're probably, shooing their kid away. Watching. Shh. So.
Good morning. I'm Carol Dixon with the Idaho Federation of Families, and we are at the end of the month, January, doing our January webinar. Today's topic is kind of a follow-up on one that we started in December that was bringing in other agencies, that are partnering agencies with the YES program. So today we have represented Jeff Brandt, and he is with the State Department of Education. Heather Olson is with Developmental Disabilities. Janet Hecky is our facilitator, and she's with the Parent Network. And Michelle Wilson is with Children's Mental Health. So a lot of this is a conversation of, excuse me, is how do all these agencies work together in the new system of care? Because there's a lot of overlap. There's a lot of needs in all those areas, and the idea of coming together and kind of creating one plan where everybody's looking at the child's best needs and how to work with and support the families. So that's today's topic. First, a couple of things to let you all know is that if you are using Zoom for the webinar, is that there is an opportunity you can ask questions. Make sure you put them in the question and answer section, and we will actually read them out. There's also a chat box, and if there's a place that you want to just share information, make comments, excuse me, give some feedback, go ahead and use the chat box. And then towards the end of the webinar, we're going to throw up some polls just to kind of gather some information, feedback about what your thoughts are, kind of things that we can do in the future as far as topics, presentation style. So, and this is for parents. If parents will participate in that, it's not the professionals who don't want your feedback, but as the for our grants, we're looking for parent-specific information on this topic. So parents is really important in terms of our funding to be able to continue to do these webinars. So please join us and participate in those polls. And for those that are on YouTube, sorry, it doesn't work on YouTube. But you can always send us. We would still love your information, so feel free to send us an email, and we would love to know what you have to say. So with that, thank you all very much for being here. We participate your time and your expertise and your commitment to the kids and families we're working with. Okay.
Thank you, Carol. So good morning, everyone. Today, as Carol mentioned, we have the State Department of Education, we have Developmental Disabilities, and we have Children's Mental Health here. So I thought the way we'd structure this a little bit today is we're going to start off with education, move to developmental disabilities, and then we're going to use Michelle over here to help us link it all together for the YES system of care. So Jeff, I'm going to start off with you this morning, and welcome. Thank you for being here today. We do want to, for families, one of the things as a parent of a child with a mental health disorder and a parent of a child with developmental disability, there are some things that were new to me when I started with the YES program. And so I'm going to ask you maybe some questions to help parents understand some of those differences. And where I'd like to start off is what, in terms of the YES program that originated out of a lawsuit, what is the State Department of Education and the school systems in particular, what are they required to do in terms of their participation with YES?
Great, thanks. So it's, as a result of the settlement, the State Department of Education was required to create a checklist for families that they might use to see if perhaps they have a student or a child who would qualify for YES services. So we put together quite a group. I think we had 18 members of that group that developed that checklist. We had parents, we had school members, we had people from Department of Health and Welfare. We spent several days created that checklist, and then as a result of that checklist, we also created a training video that was sent to all the schools. Superintendents received it, directors of special education. And that training video explains how to use the checklist, where it should be posted. It should be visible for parents to see. It should be in areas where teachers can see it. We put that video together so that we hope that all faculty and members of the school would see that at perhaps a staff meeting. So they would be aware of what the YES program is and how they might access those services. And so, and then we also asked that each school have at least one person who is basically in charge or the YES representative, so that the message that parents would receive would always be the same. So if someone went to a teacher and said, I think I might have a child who qualifies or is in need, that they would be referred to that person in that school who would be the contact person to make sure the parents got the information that they needed and were referred to the right location.
Okay, so in terms of the YES system of care that's being developed, the individual school districts are not required necessarily to participate in those. They're not directed by the State Board of Education, or could you just go into that just a little bit for us?
Yeah, that's correct. The schools are not required to do anything other than the requirement is that they just have to have the information available and be a resource to connect parents with where they need to go to access YES services.
And why is that? Why is the requirement for the school district, the individual school districts, separate or different from what it would be for everyone else participating in the YES system of care?
I don't know that I know the answer to that, but I know that according to the settlement agreement, it was all about that checklist and that schools be there to get parents in the right direction geared toward where they might find those YES services.
Okay, so I think what I was trying to get at from parents is that with the settlement agreement and the lawsuit in and of itself, it named the State Department of Education and not the individual school districts. So can you tell us a little bit about how does the State Department of Education and the individual school districts, how do they link together? Like, what does that, am I making sense with my question?
I think so, but from as a State Department person, so what we did is we got the information out. Schools, right. There is no requirement for schools to do anything other than what I had talked about. That is their requirement.
Right. So it is the school districts within the state operate somewhat independently, and it's very unusual for the State Department of Education to dictate to a school district how or what they must do.
School districts in Idaho are very much under local control. There are, when we have federal requirements or state requirements that schools must follow, then obviously we adhere to those, but this is not one of those.
Okay. And so one of the big changes with the YES program, the YES system of care, is the development of the Child and Family Team, a CFT, Child and Family Team. How does a Child and Family Team differ from or collaborate with an individualized education plan, an IEP, in a school system?
So just to be clear, the two are completely separate, and the way it is set up now, they won't interface together. There could be members of the student's IEP team that could be part of the CFT, and so that would require the family to request from the school that someone in the school be part of the child family team. It could be a member of the IEP team, but it could not. It could be another member of the school that would be part of that. With that, though, schools have the option to choose to not participate in the child and family team. I don't know why they wouldn't, but there could be a situation where they don't want to. On the other side, though, there could be, a family who does not want that specific information shared about their child with the school. So, they may not want the school to participate with it as well. Kind of a complicated situation. And then, the IEP team has its federal guidelines that they are required to do. We do those. I hope that we do those well in our schools to help support kids. And then when the child family team gets involved, again, it's just, if the family would request that and the school is okay with someone from that team being part of the team, then that would happen.
So that brings up a good question. If a family, say I wanted a representative from the school, I might want it to be my teacher, but it might end up being someone else to participate in the CFT, that child and family team talks about some very personal, very open information about my family. And it's really critical that we be able to do that in order to have the best outcomes for our children. What information from that child and family team, if there was a member of the school, would go into the child's record from school?
But Matt, that is a really good question. And that's what just to be honest, that's what scares off a lot of school people, is because some of that information that could be shared, then what is the school official required to do with that information?
Okay. And do we know what they're required to do with that? If there was personal information about my family or my child that was shared, and in that meeting we said, we do not want this documented as part of the child's school record, can they comply with that?
And I don't know the answer to that.
Okay.
Yeah, I don't know the answer. I know one thing that would have to happen for the conversations would take place is that an exchange of confidential information would have to be signed and agreed upon by both parties before those conversations could take place. And so that is one, your question is one that is a concern for schools, because if there is information that's shared as mandatory reporters, what is the school required to do with that information?
Okay. And separate from mandatory reporting, say I shared an issue that wouldn't necessarily be a mandatory reporting, but maybe, I don't know, I'm going to make something up here. So maybe I share within my child and family team that my child's father, who isn't associated, who isn't there and maybe it's a divorce situation or whatever, is something that isn't mandatory reporting, but that might be pertinent to my child's behaviors when they're with that person. But I didn't want that part of the school record. Is that something parents would want to work out before the participation as to whether or not that would be included in the child's school record, which then would be open to teachers?
Right. I would say those would be conversations that the child family team would have outside of the school person being there. Okay. Because that information would then be part of the
that would be part of the school record. So, okay. And then the other question I have is that a lot of families may think that the decisions that come out of the child and family team, part of the reason we want the schools there is because we want a comprehensive set of planning for our child. And the child's in the school more waking hours than they're in our home during the day. So decisions that are made in the child and family team, how do those get translated into an IEP? Because you said earlier, an IEP is a completely separate, school process. So can you talk a little bit about that for us?
Yeah, the child family team and the IEP would always be completely separate. One would never influence the other.
Okay.
I mean, I think that needs to be very clear, because the IEP team has a set of federal guidelines that they have to follow and that they do follow. And that's what drives the IEP and the individual program that the student would need.
So if something came out of the IEP where the IEP team said it would be very beneficial for this child to receive X service and support in the school, right? Maybe it's, I don't know, speech therapy, or maybe it's a behavioral intervention plan. Just because the child and family team recommended it doesn't mean it will end up on the IEP. But the family then could go back to the IEP and say, this has been the recommendation of the child and family team, and we'd like to see this implemented in the school. And then if it met the federal guidelines and could be implemented in the school, it could be added to the IEP. That would be the process the family would go through.
So if there was a recommendation from the child and family team and the parent wanted to bring that to the IEP team, certainly they could, and then the IEP team would be required to at least consider that. It doesn't mean they would adopt it and use it, but they would be required to at least consider that request.
Okay, so that would be the process that families would go through in order to translate something that was a recommendation out of the CFT into their school system. Mm-hmm. Okay. Could you talk a little bit? I asked you about this beforehand because I wasn't even familiar. So acronyms are frequent in anytime you're talking about a system of care or a school system. And the school system uses an acronym ED, where the YES system of care uses the term SED. And I know SED stands for serious emotional disturbance, and it has to do with qualifying for YES system of care services and supports. Can you tell us a little bit about the difference between the State Department of Education with ED and how those two relate?
Yeah, so the terms are not interchangeable, for sure. I want to make sure that people understand that. And that the emotional disturbance is a term that IDEA uses, or the Individual Education Act for Students with Disabilities. So that's the term that they use. To meet the qualifications of emotional disturbance comes from the Idaho Special Education Manual, and the qualifications are clearly listed on what that means. I think it's important to know that youth that are identified as ED may also qualify for SED and YES services that's determined by their mental health provider.
But it may not necessarily be the other way around.
Correct.
If your child is determined through your your cans and your evaluation that that they have a serious emotional disturbance that may not qualify them under the emotional disturbance qualification within the school system.
Yeah, that's correct.
Okay, and I know I will mess that up, so feel free to correct me because I'm sure you will. I'm sure parents will have the same issue. And then, so we had a parent want to know, what can parents do to encourage their school district to become active partners working collaboratively within the child and family teams?
I think the start should be with the school administration, because this is so new to schools and they're not going to know, quite what to do or how to handle it. So it's all going to be on a very individualized basis. I would say to sit down with your school administrator and have a conversation about the needs that your child has, where they are, what kind of services they are receiving outside of the school, and encourage the school to be part of that CFT and to want to be part of what the child's doing.
That's a great suggestion for families. I think anytime you can help educate your administrators on something new, they have a lot on their plate.
And just to follow up with that, I would, I know that parents, oftentimes their best relationship is with their counselor or maybe their special education teacher, but that's a place you could start. But ultimately it has to go to the school administrator. And I think if that comes from the family, that's the best place to start.
That's great advice, because it's true. We do know our special education teachers
right.
really well, and it's easy to go to them, but to know that that if we can, spread that message up higher, it will not only help our child, but others. Yeah. That's a great suggestion. Are there any new services that are available in the school when a child is a part of YES? They brought up school-based programs such as group therapy or after-school groups, or...
Yeah, at this time, that's yet to be determined, but as of today, there are no new associated services as a result of YES in the schools.
Okay.
As the requirements in the lawsuit continues to grow and change, that could change, but where it is now, there are none.
Okay. And Michelle, do you know of anything that might be associated with the school system that could be a new service or support that's coming out to help families?
I think the important thing is that if your child has a need and they're working with a clinician, they're working with a field care coordinator with Optum, to be asking what services can kind of fill those gaps. So maybe the service isn't directly provided in the school, but it definitely can be linked. And we can, there's even family-based therapy, there's home-based therapy. There's a lot of types of services that are growing, and accessibility, I think, we're definitely seeing that increase. But so don't hesitate to talk with the different people that you're associated with, from your field care coordinator to your clinician, to see what linkages can occur. Because like you were saying, Jeff, I think we're hopeful to see some of these services be created. We're very excited to see them, but they're still being developed, and we're in a wait and see process.
Yeah, all the services and supports for the YES system of care won't even be rolled out until this July. So, and it'll take a while to get all of those up to speed. But, so do keep asking questions. And if you have a service or support that you feel like your child would qualify for, or there may be a new service and support, keep asking those kinds of questions. We had another parent ask about the State Department, what the State Department of Ed is doing to create opportunities and train educators about trauma-informed care.
That's a very timely question, because just yesterday, Superintendent Ybarra, in her presentation to the legislator, talked about her KISS initiative, the Keep Idaho Students Safe program. And there is an emphasis on that for educators to get professional development opportunities specifically around trauma. So that's something that she talked about yesterday. In addition, at the annual prevention conference that takes place every year through the State Department of Education, this spring, there is a whole entire trauma thread for people who are interested in that. In our own office, we have one of our members, along with someone from SESTA. SESTA is the Special Education Support Technical Assistance Program that works closely with the State Department of Education's Special Education Division, who are attending trainings specifically on trauma. And then I have a brochure. I'm going to just lean over here and grab this. There is a training that St. Alphonsus Hospital is doing called Healing Encounters, and all of the members of the SESTA program that I mentioned, I think there's 11 of them, who provide support to our special education teachers in Idaho, will be attending this training as well. So lots going on with trauma right now.
That is great to hear on all levels. And then one final question directly for education, that a family wanted to know if services, communication, and collaboration are not going well with the school system, what options does a parent have? Are there contacts they have? What do you recommend for families?
So in the practice manual, there's some guidance in there, and actually on page 61, it talks about the complaint process and gives pretty clear guidance on how to do that. Families can share that information with their provider, and that information is then brought over to us at the State Department, or you can go directly to our office, the dispute resolution coordinator, and file a complaint there, and then it initiates a formal complaint process that we would then go through.
Okay, so that's very helpful, because I know families sometimes struggle with that. One other thing I would add to that is if you do feel like you're kind of especially in the beginning stages of finding some conflict or some disagreement with that, also to reach out to Idaho Parents Unlimited. It's called IPUL, and they specialize in helping families that have children with both serious emotional disturbance and developmental disabilities and navigating the school system. So they can be of assistance there in helping you understand things better, maybe, and give you some opportunities there. So, well, thank you. I appreciate that so much, Jeff. We're going to transition a little bit here into more the developmental side, and speaking with Heather here. The first question we've got are, how are YES and developmental disabilities working together for children with dual diagnosis, and what is typical now versus what do families expect will change in the future?
Well, just to give a little bit of background on where we've started and where we are today, we launched a pilot program in April of last year to get a feel on how it could work, how we are going to collaborate. And what we did is we offered the option to families of children who have developmental disabilities and also have a serious emotional disturbance and qualify through the YES program, the option to write their plans for both service systems collaboratively at the same time, so that we could streamline it. You don't have to do two parallel systems at once. And you can...
Sorry.
So that you can streamline the plan of service into one instead of having to do two separate service systems. So for a lot of our families, they've been operating in parallel universes, so to speak. Here's my mental health and here's my DD, and it's been very compartmentalized and siloed. So our goal was to try to merge those two pieces together, because as you said, there's a lot of overlap.
Right.
And, we tend to not treat kids in a box. We know that kids who have both diagnoses, those things are going to manifest both ways. So we wanted to give a more holistic approach to the process and make it more family-centered, make it more person-centered. So the intent was to consolidate it into one. And it's been offered to families as a completely optional choice. What that means for right now is that the developmental disabilities case manager would write the mental health plan, and they would be able to do it all with one person, that DD case manager with whom they're already familiar, rather than having to go to a secondary person. Right. So consolidating that. Again, completely optional. If a family doesn't want us to write the mental health plan and they'd like to have children's mental health write it instead, that's absolutely their prerogative. We do have some cases where, for example, sibling groups where one child is dually diagnosed, but there may be 2 or 3 kids who are SED only. And so it's easier to just go write all 4 of those plans with children's mental health rather than one with DD and then the other 3 with mental health. So it's been offered as a completely optional choice. It continues to be a completely optional choice, but that's what has been implemented in the pilot, and we found that it works pretty well. So far, that's what you can expect in the future as well. But again, I want to emphasize that it is a choice for these families. There's no requirement that if your child has a developmental disability and mental health diagnosis that you have to have your mental health plan written through DD. It's absolutely optional.
Okay. So if so we have some situations where families have a child with a primary diagnosis that's an SED,
sure,
but may have some secondary developmental issues. Is it now, or is there any plan in the future to potentially have your SED person write your developmental plan and your SED plan, or is that something that?
So we do have the option that if a community mental health provider, a network provider wanted to write the developmental disabilities plan, they could through a contract with the Division of Family and Children's Family and Community Services.
Okay.
So they would just be a contracted provider for that plan development of the developmental disabilities plan. So that is an option.
Okay.
We haven't had that come up yet, but if a family, and I mean, obviously if a family wanted that, they would have to approach their mental health provider to see if that provider was available and willing to do that.
Right.
But it is an option.
Okay. So that's a great thing for families to be able to know that, if you have that great relationship with someone and they understand the other side of it, that's a potential for them. So that's really awesome to hear. If a child is currently receiving services in just one department, what is the process to access needed services in the other? So a child is currently receiving only, SED services and they need developmental services, or the other way around. Is there a process for?
Well, I'll speak to if they start in developmental disabilities first. So generally, and I would say that it works much the same way that it has for quite some time, even prior to when developmental disabilities began providing the dual piece through the YES project, in that when our case managers identified that a child had a secondary diagnosis and that perhaps mental health services were appropriate and perhaps necessary, they would refer out. And we've collaborated with Children's Mental Health far before YES even became part of our process and was even on our radar. So we participated in monthly staffings about kids that we have shared. So I think that process would look very similar in that we would refer that kid over. Now we would probably say, hey, have you heard about YES services? Maybe you should go to Liberty to get an assessment. So we would probably, that element would probably be added to say, maybe you should go get an assessment at Liberty through YES services. So the referral process looks much the same. And I would imagine similar for CMH, the other way around, SED to DD.
Definitely. And I'm glad you spoke to the fact that we have been collaborating
Right.
for a number of years. And these are our kids.
Right.
And so I think that relationship has always been a good one. And we have seen a lot of DD workers from the community and from the system being at the CFTs, being at wraparound meetings, and that's an important collaboration. They're an important part of that child's team. And so I think that for a parent, if you feel like you don't have adequate engagement on one side or the other, then I would definitely be talking to, the DD case manager or your CMH worker and say, like, hey, is there more we can do? Is there more collaboration?
Absolutely.
Is there someone we can call? So just know that we're a system that really tries to collaborate and put as many services to support a family and a child as possible.
Particularly the complex kids with the dual diagnoses. Those are some real challenging ones there. And I do know too that if you are going to Liberty, if you're a new parent and you're not necessarily a new parent, but you're new to the system and you're going to Liberty for either a developmental assessment or a serious emotional disturbance assessment, you can actually request that they do both if you feel like you have a child that might meet both.
And I'm glad you mentioned that, because one of the things that we're working on ongoing, and as we've gotten, now that our pilot is over and we're doing day-to-day business processes, we are working on aligning the eligibility dates for YES and DD so that they can happen at the same time. And then, right?
We're doing this one now.
Shocking. Yes. So there will be that first year, there will be a situation where you will probably do one, you're going to have to do one early, and it will likely be YES. So you maybe have come through YES in October and your DD comes up in April. You're going to do YES twice in 6 months, potentially. We're still working out some options with how that's going to look with Liberty and what we can do on the Medicaid side and so forth. But assuming that we can do that, we would align that so that, hey, your eligibility for YES and DD is at the same time, which does make for a long appointment. And it would be an option. But my thought would be, in a 2-week period, maybe you'd have a couple of appointments where one you would do YES and one you would do DD, but it would happen
with the same provider,
same provider within a shortened period of time, as opposed to, I'm going to go to YES here, and then 3 months I'm going to go to DD, and then I'm going to do my DD plan, and then a few months later I'm going to do we'd like to shrink that time frame down so you can do both eligibilities at the same time, and then subsequently do your planning for both sets of services at the same time, and then have it just sync up after that. So every year after that.
Yeah.
So,
and this is one of the great things that the YES system of care has been working towards, right? We've talked a lot in our past webinars about how we're trying very hard to make things easier for parents and more family friendly. And this is one of the great things that we have actually started to accomplish, is that families now can have one meeting or have the same provider. And like you said, if they have to do one meeting for developmental and one meeting for SED, when you have the same assessor doing those meetings, you don't have to repeat yourself.
right.
You're like, you remember all that stuff we talked about Tuesday? Same applies plus.
Right. And the same goes for the planning, because so for a person-centered plan, the requirements, federally speaking, are the same. A person-centered plan is a person-centered plan, regardless of what system you write it in. So much of the questions and all of the requirements that we ask, and all the questions that we ask in developmental disabilities, mental health is asking those same questions, which is why we looked at this as an opportunity to say, let's cut out some of that extra and let a family tell their story once.
Right.
To one, and I mean, they're going to have to tell it to an assessor and then a plan developer, but at least it's the same person for this eligibility piece and the same person for this plan development piece.
Well, and the person who is doing the plan development is reading the assessment,
Right.
and the family should have seen the assessment before it was
Right.
approved. The family has a chance to go through it and see it and make sure that it meets, that it actually says what they wanted it to say,
Right.
what they think, what the information they convey. So
And if
does
your
that make
plan
sense?
developer is reading it all, in theory, they wouldn't have to ask those questions again. Because
Right.
it's there.
They might ask clarifying questions if
Correct.
there was something that they were unclear on, but it
Sure.
does. I mean, the whole point here is to prevent families from having to re-traumatize themselves and their children
Absolutely.
by having to tell sometimes very, very traumatic stories over and over
Mhm.
again. And to be able to really focus on, okay, now we have the big picture, which we've never had before. I mean, when you talk about from a developmental side or a serious emotional disturbance side, families have never, and providers have never had the whole story, the whole picture of what really is going on within the family and what does it look like. And I think that for me, at least, it makes me really happy to know that if we were going back and doing things over for my son now, that they would be able to take into account that he has a sister that has a very significant disability and ask him questions about how he feels about that. And maybe that would have brought out things that we didn't get to address. So I'm super happy to see the collaboration that's going on and even the encouragement that's going on within the school system to acknowledge that, yeah, these are complex cases and we do want you being able to have all the information that the family wants to have shared within the school system as well. So that's awesome. So a question here from a family: if the developmental disability staff is writing the person-centered plan and providing case management, how knowledgeable are they about mental health needs, services, and providers?
Yeah. So our program, our case managers are trained in person-centered planning and the development of that. So, and part of that is identifying needs and referring out for services in the community, kind of like what we've already talked about. We've provided training to our staff and contractors on the YES services available, so they know what they are, and we're going to continue to provide that ongoing training and in collaboration with CMH, the YES project team. And we also, again, collaborate with those CMH clinicians and the community health providers as part of that child family team to make sure the kids are getting connected to all of the services. So, it may be that you have a DD case manager who is very knowledgeable about mental health specifically and has a lot of experience, or perhaps not. But the intent is that we have enough of the knowledge about where to refer them to so that they can get connected to the services they need. Very similarly to what Jeff was speaking to in the school district, in that we want to connect you where you need to go. So a big part of our responsibility is to know what the services are, or at least know, hey, you need mental health services. We're going to connect you to this CMH clinician. We're going to collaborate with you. Who's your mental health provider? I'm going to work with them as part of that child family team to figure out what it is that you need.
So is there, it just occurred to me, is there any kind of, when you get a child that comes in for the person-centered planning process, does someone look at like what the needs of that child are and try and match them up with a person-centered planning provider that maybe has, so say it's someone who comes in with maybe a more complex like RADS or something like that and develop, does anything happen to look at that and say, hey, this person has a little more experience on the mental health side, so let's let them do the person-centered planning?
So we do have, when we have children who are, we do have what is called complex versus standard case management, which our program is currently in the process of a major shift ourselves. So when we have a child who is extremely high needs and maybe involved in, say, the crisis with the crisis team as well, we do assign them to a quote unquote complex case manager who has a little bit more of an ability to handle those situations, and particularly our department staff as opposed to our contractors who have a little bit more proximity to children's mental health in the same office building. But we also have some incredible contracted case managers who are really good at what they do. So we do look at that and our supervisors do a great job of trying to connect a child with a case manager who they think is going to be a good fit.
Okay. That's great.
And also to piggyback on that, at any time, if your case manager isn't working out for you, you can request a change. So,
and I think that's something that a lot of parents are reticent to do.
Yeah.
Right? They kind of feel like this is what they get.
Yeah. It's a little bit different in the family directed program with our case coordinators, but for the traditional program, if you have a case manager that is not working out for you, you can certainly speak to the hub supervisor about that.
Great. That's great information. When you have multiple services from both departments, who can and should be on a child and family team?
I think anybody the family wants to have on their child family team, as long as that individual or entity is willing to participate, could certainly be on the child family team. We work really hard with our families to provide choice and are very intentional in letting them know that they can invite whomever they want, or they can choose to not have somebody there if they don't want that person there. We've certainly had instances where a family has been very explicit in saying, I don't want this individual or this entity at my child's planning meeting, and we honor that. So I think we would do our very best to invite whomever the family wanted. I mean, obviously we can only do that if we know who the family wants there.
That's true.
So occasionally there will obviously be situations where perhaps a provider we didn't even know about, it was like, wow, what happened to this meeting? Well, we didn't know. Right. But I think that as long as families are saying, I need this person here, we would absolutely extend an invitation. This is all about family choice. Whoever you want there can be there.
Okay. And are we seeing providers starting to participate, like Optum providers starting to participate in child and family teams? How is that going? Do you know?
So it's a fairly recent avenue that providers have been able to build for that time that they can come to the CFTs. And so I've been at some, variety of different meetings where Optum is there and Medicaid representatives are there, and they definitely are. They say that funding avenue is out there, but I think until providers start to actually successfully bill that, and then they're able to say, oh, this is something this was great, and then they share it with others, and I think we'll continue to see it grow and grow. But we have seen some providers actually come to those meetings, be able to bill for that time, because that's the big piece, is that it is time that they're taking out of their ability to privately bill and to come to those. And we just want to remove every barrier possible to get those people there. And like Heather was saying, this is a principle of care for, yes, is family voice and choice. And we really want to support who the family wants at the table. And that is just a key piece to that.
So I think it's really important for families to know too that you may be the one who's educating your providers on the fact that they can get reimbursed for this. So when you are extending invitations, or when your care coordinator is extending invitations to providers to come and attend the CFT, it's important. Remind them, this is a new Medicaid reimbursable service. You can be reimbursed for attending the meeting. And we really want you there because your voice in terms of making a plan that's going to work for our family is very important to have at the table. And it's very important for you to hear the other information from the other providers so that we can really collaborate together. So at this early stage of this YES development, it is really critical for parents to tap into your voice and to realize that you may be educating providers or encouraging providers to do something they've never done before. And get feedback from them and give that, feed that back to us at the Idaho Federation of Families in some way and let us know, hey, my provider went and they thought it was a total waste of time, or my provider went and they learned so much new and the whole thing was so much better, which is obviously what we hope happens. We hope that's the feedback we end up getting, but it quite possibly could be the other way around. And if that's the case, then we need to know and understand what is and isn't working in the system. And at this early stage, parents, you are the voice as to what is and isn't working. And it's really important for families to be able to acknowledge that.
We certainly can't fix what we don't know about. So we absolutely encourage all forms of feedback.
Absolutely. Okay, so another question here. When using more than one agency for services, how is a PCP? So a PCP is a person-centered plan, not your primary care provider. That's something from another same acronym, totally different meaning. So how is your person-centered plan being communicated to all the child's providers so they're all working off the same plan?
It's disseminated to all of them that are working with that child. So obviously we have releases and so forth, but the providers that are identified on that plan and those that are identified as part of the CFT that the family wants to get a copy of that plan will get a copy of that plan.
So if I have a provider who's providing a mental health service to my child, then my understanding of the way a person-centered planning is set up, so feel free to correct me if I'm wrong, is that the individualized treatment plan for that service that my child is receiving is part of the person-centered plan. Is that
not necessarily? Well, to me, the person-centered plan is different than the treatment plan.
Correct.
So, are you asking if the treatment plan would be shared with, say, a DD provider?
So, I guess what I'm thinking about is we have, I think of a person-centered plan, say, as an umbrella.
Sure.
And under that umbrella, if you have a child, in these cases, we're talking about dual eligible child. So you might have a child who has speech therapy and a child who has psychiatric therapy and a child who has just a regular psychotherapist, which would be different from your psychiatrist therapy.
Correct.
Right. So, but each of those treatment plans, so your treatment plan for speech is underneath the umbrella of the person-centered plan. And so each of these, so those treatment plans, one is assuming that the provider would have to be a part of the person-centered planning process so that that treatment plan aligned with with the service and support, the way the services were going to be delivered to that child.
I get you.
Correct?
So we would share the umbrella person-centered plan with all the providers, whomever the family wanted us to share it with.
Right.
So generally that's going to be your developmental disability provider and your mental health provider. If the family wants treatment plans shared across the board, they absolutely can do that. At this time, our case managers do not disseminate those.
So the mental health treatment plan wouldn't be shared with the speech therapist.
Correct.
But the speech therapist treatment plan would be under, like if the parents went and looked at their person-centered plan, they would see the individualized treatment plan for speech therapy under there? No.
They would see on the person-centered plan that the child's receiving speech therapy, but the treatment plan for speech therapy wouldn't be embedded in the PCP.
Yeah. So, so I do need to let everybody know we do have polling that's up, so please do participate in that. And so I guess and this is all new to me. I'm learning as we go too, folks. So if I have a mental health provider who is providing service for my child, and let's say they don't participate in the child and family team, how are we ensuring, or are we ensuring at all, that and this might be more a question for you than for you, but how are we ensuring, or are we ensuring at all, that the way the services and what services are being, the treatment plan for that psychotherapy, let's say, is consistent with what we came up with in the child and family team?
So, see if I can answer that, because I think it's complex in that we have the person-centered plan is more of an umbrella.
Mhm.
And every time a child's plan changes, specifically their treatment plan with whether it be their speech therapist or their individual therapist, those have to be much more fluid
Mm-hmm.
than the overarching plan. Because again, we don't want families to have 5 meetings with 5 different people. And we want to have it be as simplified, but still as smooth, and people be knowledgeable about it.
Mm-hmm.
So I know that parents are definitely given a copy of that person-centered plan at their request. They can disseminate it to whoever they want to, because again, it's their voice and choice. And then I know that on the billing piece, if there is a Medicaid or Medicaid provider, that there have to be linkages between the plans.
Right.
But we definitely don't want to have every time one of those individual plans with an individual provider changes, you want to have everyone come back to the drawing board and recreate.
I mean, you could have a kid potentially meet 5 speech goals, in 3 or 4 months or 6 months. And we certainly we wouldn't recreate the wheel and send it out every single time a kiddo met an objective. Right. But everybody on that team would know this child's receiving speech therapy, this child's receiving X therapy, and kind of an idea of what they're working on in those systems.
Right. So I think where I was headed with this is my thought process was, it used to be that we had all of these different plans out there, mm-hmm. and that the person-centered plan and the child and family team kind of coordinate all of that. So we're all working towards the same goals. Sure. But if we have a provider that doesn't participate in the child and family team and then develops, but is a service that's on there, right? Okay. So we have a service.
Right.
But maybe their goal, and this is going to I have to come up with something off the top of my head, so it's going to sound weird. But so maybe the child is having trouble staying awake in class. And so the school would they talk in the child and family team and say, okay, well, we need the child to get a minimum of 8 hours of sleep a night. So we're going to adjust all of these other things before bed so that the child is in bed at 8 o'clock and gets their 8 hours of sleep. And then you have the psychiatrist, let's say, and on their plan, they're adjusting medications or whatever. And maybe the medication they're giving them gives the child an inability to go to sleep. We have people that are working cross purposes. And part of the whole idea was to coordinate all of that. Right. So is there anything in that process for families that would help coordinate and prevent that? Or because, like I said, I haven't been to a child and family team, so I don't know exactly.
I would hope that a meeting of the child and family team would address that. But to your point, if you have a provider providing a service that doesn't participate in the child family team, that does make it challenging.
Right.
So I think that's something that we can definitely work on and do our best to address. I mean, I think that it's going to fall to the families a little bit to gather those plans and say, wait a minute. And then maybe we need to bring that CFT back together and say, we've got a disconnect here that we need to address and figure out what we need to do to remedy that.
Right.
So in theory, the solution I think would be you've got to have all the providers at the table. Mm-hmm. But if you don't, for whatever reason, I think that facilitator is going to need to reach out to whatever providers did not participate to ensure that we're not missing a piece. So,
okay. And that's something that a parent could ask the facilitator to help with.
I think so. Yeah.
They could say, so you could say, hey, I've got this psychiatrist and, I can't remember all the different things with the meds and everything. Can we just follow up and make sure that everyone's kind of on the same page there?
I think that would be part of the purpose. Yeah.
Okay.
So would you disagree, Michelle?
Oh, no, absolutely not. I think that when we talk about
or would you agree is rather what I should have
said. So when we talk about the person-centered plan, it also is, you can pull that team together anytime.
Absolutely.
There are questions or issues, don't hesitate to, for the parent to ask for that person-centered plan team, that CFT, child and family team to come back together.
Right.
And to address those issues. But again, I think communication is always going to be
Totally.
a challenge
Yep.
between all these different parties. And the more that I think parents can feel empowered with their plans, with the, knowing that their voice and choice is so important.
Mm-hmm.
And that's kind of the pieces that we want to give. We want to give parents the opportunity and the power to bring those issues forward if they think there's a problem.
Yeah. I've always said, as a parent, you are your child's best advocate. And I think there are some situations where maybe we didn't even know that there was a psychiatrist that was treating the child. So if there's a provider out there, we want to be able to absolutely reach out to him. But again, we've got to know about it to be able to do it. So as your child's case manager, tell us who those providers are in your child's life, and we'll work with you to reach out and collaborate with those individuals. But definitely, if you're noticing a disconnect, advocate for that and say something is not right, and maybe we need to bring the CFT together to fix it.
That is a great segue into another question the families had. If communication and the collaboration is not going well in a child and family team,
Mm-hmm.
what options does a parent have? Who should they contact? What do you recommend for that?
The first thing that I would say is your child's primary developmental disability case manager is generally going to be your first contact. Anytime you need something, that's the first go-to. If for some reason you're not getting your needs met at that level, you head up to the next rung on the ladder. We have hub supervisors in each of the Northwest and East hubs, and those folks directly supervise the developmental disabilities case managers. So you can go to the supervisor. We have program managers at the developmental disabilities program at central office. We also have a quality improvement team that addresses any complaints or concerns, specifically in regards to developmental disability services. If we have one come through that relates specifically to guest services, we would then refer that to those folks to follow up accordingly. But we have a complaint and grievance process for a reason. So work your way up and start with case manager. But there's definitely obviously other folks that you can speak with if those needs are not being met at that first level.
Well, I think one of the things for families to get accustomed to is the fact that you're going to have, you're an equal voice with everyone else who's sitting at the table. And it's going to be challenging at times. There are going to be different points of view about how you reach the end goal and even what end goal needs to be reached. As parents, we frequently get a little lost in the forest because we don't necessarily see the bigger picture. So it is important to listen and see if there's a way to reframe where you are in the process and what you're doing. But also know that your child and your family better than anyone. And if everyone is urging you to work towards a goal that just doesn't make sense or doesn't matter to you as a family, that you're not going to make progress there. So it is important to really understand that if you have dissenting voices, that's not necessarily a bad thing. It can open up everyone's eyes to seeing something from a different point of view, and maybe being willing to explain from your family why you don't see something in the same way and why it might not work for your family. It may be a cultural issue. It may be a language issue. It may just be my child just doesn't give a flying rat about getting out of bed in the morning. And we can all sit here until the cows come home, saying we're going to do everything short of throwing ice on the bed in the morning to get them up. But what would really make a big difference for me is, him being able to go on his first date, or, whatever that is. That I don't care if I have to drive him to school every morning to get him to school on time. So the morning thing isn't a big issue. And obviously just a made up story there, but it's hard to make some stuff up on the fly, but I do think it's something families have to get used to is being able to sit at a table with providers they're there to help. They want what's best for you and your family, but to be able to educate those providers and sometimes the school systems on really what your family sees as being best meeting the needs, because it's not just the child. Each of those providers is more dealing with just that child, and you really are dealing with what works for your entire family.
And just on that note, as we progress with the YES program in particular, and more providers are using the cans, the cans is going to be an excellent tool for families to use in those conversations. And that's exactly what it's meant to be. And I remember listening to Dr. Lyons and some of the training that I've been in with him. And the cans and the questions were really, parents were a part of developing those questions. So that it isn't, so parents don't always feel talked down to or patronized by the professionals at the table. But you're all speaking the same language. And so I think the cans is really going to open up some opportunities too, especially as we see providers using it more and more.
And providers getting accustomed to using it not as just a checklist tool.
Right.
This isn't the cans really, we've talked about this on other webinars, how it's a conversation, and it's a conversation about what's important to you and your family and what your family has experienced. And that's the foundation for providing this big picture for all the providers to work off of and from. So I'm really glad you brought that up. I think it's a big transition for providers out there to be able to use this new tool and see it as more than a checklist evaluation tool. It really is an opportunity for you to be able to engage your families on a level that haven't been before. And just bringing up one thing on that, we actually have we have a TCOM conference. So it's TCOM stands for, if I can even remember, Transformational Collaborative Outcomes Management, but they are the group that designed and started the CANS, the Child and Adolescent Needs and Strength. And there is a conference coming May 1st to Idaho. So it will be here, and parents, we have slots open for you to attend the conference. And we're hopeful that Dr. Lyons will be there, and you'll get to hear a lot about the whole paradigm shift that this YES system of care is trying to implement to be able to make things work really well for families throughout the state and providers too. So do we have any questions or anything, or any more polling for today? Okay, well, I just want to thank each of you for coming and sharing your wealth of information with families and being a part of our webinar today. Thank you so much.
Thank you.
You're going to make us keep going for 4 minutes? All right, well, never mind. I take back all my things. I do have one other question that a family brought up with regards to education. And this happens sometimes that, when you're dealing with each of the individual school districts, you have so many different staff and different people who have different level of exposure and education when it comes to mental health. And this is really children's mental health is a relatively newly acknowledged area where we're not looking at things necessarily in terms of behaviors, but in terms of actual mental health issues. Is there anything, or what is this school system, both on the state level and it kind of ties in with what you were talking about earlier, but on the state level and also in the school district level, to help teachers and staff understand better mental illness and what kinds of behavioral interventions might help children be more successful when they do have mental health issues?
Yeah, I'd mentioned the Idaho Prevention Conference earlier, and there's always a good quality thread around children's mental health at that training. And I think there's 700 or 800 educators a year that attend that. So there's always training opportunities out there for teachers, administrators, and staff to help students with those issues.
So we would encourage, if you have a school district maybe with it that could use a little extra, you feel like maybe has a staff that could use a little extra training, maybe see about someone in their district going to that conference.
Yeah. Okay.
And the checklist that the schools created is also available on our Yes Idaho Gov website, and also on, I think, the State Department of Education clearinghouse. So parents can also have access to it. And honestly, I've looked at it, I've shared it at a couple of meetings. I think it's a great checklist that doesn't require a lot of, you don't have to go in and score it and do all those kind of heavy weighted things. It just really is a very, I think it's very clear, and it definitely creates conversations. So I would just encourage people to go out and look at it, and for parents to know that you have access to it. You don't have to necessarily see it provided somewhere at your school either.
It's also available on the Parent Network website and the youth checklist. There's actually a youth checklist out there as well. If if you are a youth and you feel like maybe you have some issues that you would like to know whether or not they might be mental health issues, the youth checklist could be very helpful in starting that conversation and helping make that kind of determination as well. So, yeah, very good information out there for families. I really don't think I have anything. Is there anything else? Do you all have any other comments? Anything that you would like that just in particular you'd like parents to know, resources for them, or anything that we didn't discuss this morning? We kind of walked right through it. We have a question? Oh, well, the Federation is always a resource, of course. Carol reminds me. Yes, if you do have a child that does have a mental health issue and you're struggling with any of these areas with coordinating your care or with the services and supports that you're receiving through the YES system of care or through your school system, you can always reach out to the Idaho Federation of Families. That's what they're here for. And they certainly are a fantastic organization that has helped spawn the parent network and all the rest. So do feel free to go to the Idaho Parent Network website as well, as they have a checklist there.
We do have one question.
Okay.
Actually for the schools. Is are school counselors doing the cans as well?
No, the cans is not being done in schools.
Thank you.
All right. Well, now I can officially thank you since we've reached our time. So thank you all again for coming and being a part. And Carol, did you have anything about the upcoming webinar next month, or we don't know right now where?
We'll be sending it out.
We'll be sending that information out. All right, everybody, have a great day. Thank you.